Restylane or transconjunctival blepharoplasty with fat repositioning. My eyes and dark circles give me a very tired and aged look. I have significant hollowness in my tear trough, and I'm wondering which procedure will give me a more satisfactory result. I hope the photos are sufficient. Everybody I see seems to have a different answer, which leaves me confused.
Thank you for your question. You have clearly done a lot of research when you ask the question about Restylane versus transconjunctival blepharoplasty with fat repositioning, and you've expressed frustration about getting opinions and getting so many answers. So naturally you've submitted a question and you want to get hopefully maybe some consensus. So understand that every surgeon has their own unique perspective based on their own experience as well as their own aesthetic. You know, for years I was always troubled by working on the Upper East Side and seeing so many people look so plastic. And I wondered what was going on. And I realized later that essentially, like the student finds the right teacher, a person's unique aesthetic is what will resonate with a particular doctor. So on the Upper East Side, there were a lot of doctors who believed in this doll-like aesthetic, and there were a lot of people who shared that. So what I can do for you is give you a perspective as an experienced cosmetic oculofacial plastic surgeon in practice for 20 years. You see, you do have a couple of conflicting issues that makes things confusing. On the one hand, you have puffiness, which is lower eyelid fat prolapse, and on the other hand, you have hollowness in the area of the tear trough. I wrote a book a few years ago called The Fine Art of Looking Younger, and what I shared from experience is that facial aging is two things. It's volume loss, which is what you're seeing with the tear trough area, and descent. Now, what's different about the eye area is that the puffiness and the tear trough being deep or shallow, or hollow I should say, can be manifested at a younger age. So there are more than a few ways to address this, but I'll share with you what I typically do in my practice. First, what I say to my patients is the puffiness is like a mountain. And the power of contrast is that the hollow of the tear trough is accentuated by the height of the mountain. So, strategically, what I try to do is I address the anatomic or dominant issue first, but I educate my patients about the overall context in which everything appears. So we take a step back and we look at the puffiness and the tear trough area as it applies to an area of the eyelid and the cheek. You see, I think of the eyelid not as someone who also does facelifts and does a lot of facial rejuvenation surgery. I look at the eyes in detail and I look at the face globally. And I think that what is often misinterpreted as hollowing under the eyes is due to a disconnect between the appearance of the eyes and the cheek. So I call it the lid-cheek relationship, where volume in the cheek and the transition between the eyelid and the cheek is very important to get an overall aesthetically young-looking appearance. So what I would typically do with someone like yourself is I would address the puffiness. I would address the puffiness because it's the dominant negative that affects the appearance. Now think about it. If you apply a filler like Restylane in the tear trough, it is unlikely that you will camouflage effectively the puffy bags. There's a strategy where puffy bags are slight and you can camouflage them with a little bit of filler in the tear trough. But my first approach would be to do a transconjunctival blepharoplasty. I would address the skin with something called fractional CO2 laser if your skin type is appropriate for it, and as well as the application of platelet-rich plasma. Platelet-rich plasma is a strategy we employ based on drawing your own blood and spinning it and concentrating the part of the blood called the platelets. Now, these platelets are responsible for healing, and we've had tremendous success in using this wound healing and regenerative technology that we're employing in so many other areas of our practice, particularly in our hair loss treatments area, where we're using this to help make the skin quality improve. Platelet-rich plasma has something called vascular endothelial growth factor, and improving skin quality under the eyes or around the eyes as well as in the rest of the face has been a really interesting and remarkable benefit that we've been able to help our patients with. Once the puffiness is addressed, I tell my patients, then we'll reassess and we'll make decisions about fillers and volume enhancement. And a lot of times I'll do a combination of a filler for the submalar or cheek area using a material like Radius, as well as placing a material like Restylane into the tear trough area. Now, there is a lot of artistry to this. This is not about just the materials that are used. It is really also about the experience and the artistry. It takes a lot of time to do this right and do it well. So I try to explain to my patients that, you know, this is more of a journey than a single solution destination, and that your face is a dynamic structure. Now, for many of our patients, once they address the puffiness being addressed is more than enough. They're happy. They don't need any more fillers or volume. They may come in periodically for some skin care, hydrofacials, things like that. So there is a change in perspective when you take away the negative. So I think that what you really should be considering, at least from my perspective, is a strategy that does not require everything to be addressed at one time, and that you can get a lot done at one time with a surgical procedure, but that the rest of your issues can be addressed strategically and slowly. So I hope that gave you maybe a little bit of a different perspective from the opinions you've been getting. I hope that was helpful, and thank you for your question.